stage is Sheridan Miyamoto to talk about the safety scope.
Good afternoon. My name is Sheridan Miyamoto. I'm the director of the Sexual Assault Forensic Examination Telehealth Center in the College of Nursing. I've been a forensic nurse for 20 years, have performed 4,000 sexual assault exams for pediatric and adolescent patients. I'm excited to talk about the safety system, a solution that provides exceptional care to victims of sexual assault. Sexual violence is a public health crisis in our country. SANE nurses, or sexual assault nurse examiners, are the ideal response when a victim comes forward for care. Research shows that physical, mental health, and judicial outcomes are far better for victims of sexual assault when cared for by SANE nurses versus untrained emergency department providers. The problem is there are not nearly enough people to do the work. It's emotionally burdensome, so there's high turnover and burnout. There's no peer review for people who are working in remote settings, and all of this results in substantial disparities in the quality of care based on your address. We have created a hub-and-spoke solution where an expert nurse supports a less experienced nurse through live, secure exam telehealth mentoring. The expert nurse, or telesane, is not only able to see and interact with the patient as if she's in the room, but she can also see exactly what the local nurse is seeing behind the safety scope, allowing us to identify injuries and ensure that evidence is not missed. In most U.S. hospitals, this work is conducted by someone without any training, who opens an evidence collection kit in front of a patient and reads instructions, failing to provide the person-centered, trauma-informed care that we know promotes healing. When a hospital partners with our expert hub, we ensure that an advocate is present for the patient, we deliver care that is without blame or judgment, and we ensure, by us being a second brain for that nurse, that documentation and the great scope of evidence that needs to be collected is done correctly. Imperative to this work is that we are able to get high-quality images of the body and securely and safely protect those images. We have built a mobile device that is powered by a custom magnification lens, a smartphone, and a unique application. Our device allows us to collect high-quality images. It has built-in, easy-to-use telehealth technology for real-time peer review and exceptional security. No images ever live on the device. They're transferred directly to a secure cloud-based solution that is only able to be accessed through user-based permissions. There are 6,200 acute care hospitals in the United States, all of which need to provide sexual assault services. They all require this technology to be able to document their findings, and the majority would benefit from expertise in telehealth. Colposcopes are used for cervical cancer screening. The safety scope effectively replaces a colposcope and has the added benefit of photo documentation, increased security, and telehealth capabilities. We have received substantial investment, approximately $6.5 million, to grow and build this solution in Pennsylvania. Our model and our progress has resulted in substantial new investment in this field. Texas has created a line item in their budget citing our model as a model for their program, and we're providing technical assistance to both of these initiatives.
All right, I'm going to have to stop you there.
Okay, thank you.
So you have both a device and software or an app that
Yes.
tie together. So in a lot of these cases, DNA is an important part of evidence collection. Do you have any capability to pulling DNA as part of the information packet?
So DNA is, all of the evidence collection kits go to crime labs within each state. But what we do have as part of what we offer is that we're actually doing active research on the model. So we have the ability to work with interdisciplinary partners at all of our sites and try and follow that trajectory to determine if we have really high quality care at that beginning moment. Do we have better outcomes as far as plea deals because better evidence was collected in that moment? So we're actively looking and collecting that data so that we can demonstrate these models are effective.
But unless I missed something, to me it seemed like most of your evidence is photographic evidence rather than actual chemical or DNA evidence.
Correct. All of that is stored by and run by Crime Lab, but we can go back to them and find out what was found at the time of the exam.
So I guess my understanding is you basically provide a virtual presence by a trained nurse, to essentially an environment where you're collecting both physical evidence and photographic evidence. And the photographic evidence essentially goes, is a special device, a custom device, then basically just sends it right up to the cloud, AWS or something like that, so you get security end-to-end. Is that the understanding of it?
Yes, so in current scenarios, most nurses without high-quality equipment are doing this with a 35-millimeter camera, taking a SD card out, and potentially burning that onto a CD and keeping that in a closet. So we can revolutionize how they're securing their images and make sure that those are secure when they might be needed for judicial outcomes.
So basically, it's a custom camera that essentially is tied with a back-end service that essentially is your vault for the privacy and security of the images.
Yes, and most companies don't, there are no companies that actually have the capability to have an outside person see exactly what they're seeing behind the camera in real time as a built-in telehealth solution to that device, and we have that.
I see. So you're both going to the cloud, and then you're going to the operator, if you will.
Right, no, so we have a secure Zoom connection that's built into the device so that in real time I can see exactly what she's seeing, help her to potentially identify a fiber or something that she may otherwise have not collected, and I can see that in real time. When they take photographs, of those things as I ask her to, then those can go up into the cloud.
So the Zoom video, if you will, that's happening in real time. Obviously, do you record that?
I currently record that for research purposes to evaluate the quality of care that we deliver, but it's not something that is admissible in court because what we do is peer review, and so it's protected.
So from a value proposition, you mentioned that your device would replace the other scope that hospitals or treatment centers would have right now. What's that cost differential?
So currently, colposcopes, which are used for cervical cancer screening, cost around $15,000 and do not have photograph capabilities. You can add a camera onto the side of that, but again, you have storage and security issues with that. So our cost would be approximately $5,000.
So you supply the equipment and the software, as you talked about before, and that total cost is going to be about, to say you were selling this to different hospitals, emergency rooms, that would cost them how much, and how much would it cost you to do it? Plus you have to have an ongoing service, right, with the cloud to deliver things. So have you sold them already, or?
No, we're fairly early. We're building
Okay.
the application currently.
I see. Okay.
But we've already built the magnification lens. We know what the phone costs. We know some of these, what these costs might be. So the cost of the device, I think the market could certainly bear that it would be $5,000. We've looked into cloud storage and what our ongoing app support might be, and that for our costs, not to each customer, would probably be about $1,000 a month.
So in your presentation, you had nurses sitting around looking at a screen where they were being trained on presumably the technical use of the product. You also get into the emotional aspects of the treatment?
Absolutely. We also have a training institute, so we do a lot of training around and teaching people who are experts how to ultimately be telesanes, which allows you to mentor and do that in a supportive way. So we really are trying not to be experts on one side and eyes and hands on the other, but instead to enhance the expertise of that local nurse and elevate what they do in their community so they're more likely to stay engaged in the work.
Thank you. That was the final question.
Thank you.
Thank you.